CGTN, China Global Television Network.
COVID-19 has exposed gross inequalities among the world's societies. Early analysis of infection and mortality shows that the poor stand at higher chance of being affected by the novel coronavirus. And this problem is increasingly being compounded by a rise in job losses and reducing incomes. And as COVID-19 continues to grow in stark numbers internationally, experts now warn that the situation could be much worse should the disease ravage informal settlements in urban areas. Sub-Saharan Africa's urban poor number at least 53 million people, and the spotlight is now turning to this vulnerable demographic as governments struggle to contain the pandemic in the midst of a lack of basic social safety nets and strained resources. So, as the world battles COVID-19, what is the status of Africa's urban poor? And what measures are being taken to protect their health and their well-being? I'm Beatrice Marshall. Welcome to Talk Africa. Now, economic downturns occasioned by the novel coronavirus have triggered governments across the world to introduce financial measures to cushion businesses and the most vulnerable in society. African countries like Egypt have in the past week rolled out cash transfers to its citizens, targeting, among other vulnerable groups, its urban poor. Adel Mahuri reports from Cairo.
57-year-old Karam Abul Wafa is quite excited to have a client. With the COVID-19 social distancing rules imposed and the lockdown during weekends, he'd be happy if he gets 2 visitors to his small shop.
I have been working continuously for 47 years, never took a single day off, and so for an old bone like me, it's very hard to stay at home or even without work. Being forced to shut in the weekend was difficult, and it had a huge effect on my income, which shrunk by 75%.
Karam takes care of 2 families, his own and his sick brothers. When he heard about the COVID-19 day laborer's stipend, he applied on behalf of his brother.
I applied immediately, but it's been 12 days and we haven't gotten a response yet. I'll give that whole sum to my brother and I'll try to manage. It's a great initiative from the president. It's a good step.
The government has started releasing a $96 stipend distributed over 3 months. Nadia is one of the millions in dire need of this grant. She hopes she'll be one of the 1.5 million beneficiaries of that program.
People are afraid to touch newspapers. They fear infection. So the situation is hard. I barely earn anything from newspapers. These are hard times for everyone. Many used to help me out. Now even those people need help. $32 will make a difference. In these times, they have become of value. I just hope I can get them. I'd be happy.
All applicants are anxiously waiting to receive an SMS from the government. Once accepted in the program, the message will include instructions to receive the stipend. 5,700 government outlets will be releasing the grant during the coming days all over Egypt. Adel Mahroui, CGTN, Cairo.
And joining us to help assess the unique risks that COVID-19 is dealing to Africa's urban informal settlements, I'm joined by Professor Alfred Omenya. He's an expert on architecture and urban development at EcoBuild Africa. Professor Omenya, thank you for joining us here on Talk Africa. Now, there are reports that an estimated 53 million people in sub-Saharan Africa live in informal settlements. That accounts for almost half of Africa's urban population. Now, it's also been pointed out that the nature of the dense population in informal settlements, poor access to safe water and poor health systems, is posing challenges to the mitigation measures that governments are taking to contain COVID-19. Assess for us the exact problem, the scale of the problem in the informal settlements where issues such as physical distancing and self-isolation could be a major challenge.
Yes, thank you, Beatrice. I think Africa's informal settlements generally were problematic even before COVID came in. The densities, first we have the densities in those settlements, which is what is being highlighted. But even before the densities, the studies that were already done that showed that morbidity, in other words, sicknesses in these informal settlements and mortality, a lot of that was directly associated with the physical conditions of these informal settlements. So you're looking at poor sanitation, you're looking at lack of running water, you're looking at poor solid waste management that encourages all sorts of vermins to actually come in. You're looking at the quality of the housing that exposes the people who live there to the vagaries of weather. And you can link this with diseases like pneumonia, diseases like TB, bilharzia, and so on, were directly linked with informal settlement, diarrhea, dysentery, and so on. So basically what you're saying is that even before the arrival of COVID-19, the physical conditions in majority of Africa's informal settlements predisposed the people living in these settlements to vagaries of disease, as it were. And we've made recommendations, including to African Union and to Kenyan government, even before the arrival of COVID, that intervention in these informal settlements should actually start with the basic social and economic infrastructure that eventually protect these people.
Right.
You're looking at improvement of the environment. You're looking at provision of basic health services. You're looking at provision of physical infrastructure, and this goes a long way towards mitigating the problem.
Right. So, of course, governments have been concerned, and many people around the world have been concerned about what exactly would happen if the COVID-19 infections reached the urban poor or the slum dwellings, informal settlements in African cities. What are some of the measures you think governments and agencies should come up with quickly and should get to grips with to ensure that this doesn't happen?
Yes, and again, Beatrice was saying that when it comes to the informal settlements, government must start working with people in the informal settlements. For those of us who've done work in the informal settlements, every single initiative in informal settlements starts by understanding people who live there. And there are quite a number of civil society organizations that do actually have data of families that are living in informal settlements. This data was linked a lot more with the evictions. It was linked a lot more with plans for development and so on. This is very useful in the sense that, as I've been insisting, that when it comes to the informal settlements, we must customize our response, and it means that we need to know who's in there. For example, we know that COVID is quite devastating for people with pre-existing conditions. We know that COVID is quite devastating for people of a particular age because of suppressed immunity. It is quite easy, as long as there's collaboration with organizations that have been working in informal settlements, to quickly profile these informal settlements and immediately put in place measures that cushions these most vulnerable, even if it means removing them from these informal settlements and keeping them in places where they can be provided by services. And the starting point is simply to operate from a perspective of understanding. And in that perspective of understanding will be provided by the people of the informal settlement themselves through the mediums that we used all the time there.
Right.
We have NGOs that have worked in these informal settlements for ages and have amazing data that through good collaboration with government, we can extract the information that we need and to enable government to customize a response. But the responses must be customized in the short term, and the responses must be customized even in the long term.
Right. So, Professor, I want to get your thoughts on the urban poor and the informal settlement. And looking at the urban population, paint for us a picture, the likely possible scenarios on how COVID-19 will affect them in the short term and in the long term.
Yes, but Beatrice, you can already see that in the short term, when, for example, you say that you're going to have a lockdown or you're going to have isolation and so on, it impacts them quite directly because these are people who go out every day to get a livelihood, and if they don't go out, they will not actually get a livelihood. So immediately you say let's restrict movement. Immediately, non-essential services are closed. So, for example, there's no construction sites which unskilled labor, work on every day and so on. You find that these people's income is directly affected. And that's why I was saying that there's need for a short-term rescue package for these people because, as it were, these people cannot be able to sustain their livelihoods currently, even with just small lockdown of Nairobi and Mombasa and so on. And in fact, it's a fact of the matter that if we decide to have a total lockdown where these people are to stay in their homes, it is going to be a socio-economic and even a security disaster as it actually were. So they're already impacted. And secondly, going forward, we know that quite a number of sectors are already shut. And areas like again, I will use construction as an example. I'll use urban transport as an example where these people tend to work very, very basic things in terms of the service industry that's already shut down and so on. So it is very, very clear that in the medium to long term, the sectors that absorb quite a bit of the urban poor, basically as unskilled labor, are going to be impacted, and it will take a long time. We know, for example, that construction industry is not going to recover even by 2022. Service industry will, but the service industry only accounts for a small percentage of the people in informal settlements.
Let me get a final solution from you, Professor, here. Let me get a final solution because we've talked about a whole range of issues on how to support the urban poor, but also from a policy perspective because pandemics such as COVID-19 and natural disasters are usually unforeseen. In terms of design and planning, what position can African cities take, though, so that the state can rapidly respond and address these issues in a timely manner?
Yes, one of the things that I've been advocating for personally, and we've been advocating for in EcoBuild, and we've tried very, very hard, Beatrice, and people are not listening, governments are not listening, is actually ensuring that our cities have resilience, that our cities can respond to disasters and disaster risk management, and our cities can bounce back, basically meaning people in our cities can be able to, get back to default settings. We put in Kenya, for example, the idea of resilience and disaster risk management in the planning framework. It has not been implemented. I finished doing work in Malawi where we had terrible disasters, not COVID, but before COVID, those are the floods last year. And again, we're saying planning and building regulations must factor this in place so that we are able to then, respond and also we are able to mitigate the impacts of disasters. Starting again with the most vulnerable, which is actually people living in slums and informal settlements. This has not been heard. As we're talking already, we're discussing with other countries outside of Africa to say that resilience, disaster management, and disaster risk is something that has to be core to planning. And we must look at all typologies of disasters, from the frequent ones that we normally have, like floods and building collapse and fires in cities and so on, to medical disasters like these ones, like COVID, which will definitely come. And we've had some of those. We've had cholera. Other parts of Africa have suffered Ebola and so on. So they're not totally new. Nairobi itself was banned, in 1904 because of the plague. Yes, so these things are not new. In fact, the origin of urban regulations was because of medical disasters like these ones. So it is ironical that in this time and age, we are not actually looking at disaster risk management. We are not looking at issues of resilience as core to urban planning and urban management. We need to restore this immediately. There's no reason why should not be the number one consideration as we are planning cities, because in any event, this is where the origin of planning and development controls came from. It came from medical disasters,
Right.
from the Black River plagues, from the rat plagues, yeah, and all those sort of things. We need to bring this back to the center of planning of all our settlements.
All right, very interesting insights indeed from Professor Alfred Omenya. Thank you very much for your insights there. Well, we're going to take a short break now, but when we return, we'll be joined by our correspondents in Lagos and Johannesburg. Deji Badmus is joining us there from Lagos, and Angelo Coppola will be joining us from Johannesburg to give us a picture of the situation of urban areas across the continent. Do stay with us.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Standing by to give us their opinions from Lagos, Nigeria, Deji Badmus is joining me from there. And in Johannesburg, South Africa, is Angelo Coppola. Gentlemen, thank you both for joining us in this assessment of COVID-19 in Africa's urban poor. Now, let's start with the situation in Africa at the moment, because infection cases are rising, albeit gradually. We're looking at over 2,500 cases of COVID-19 in South Africa, over 200 now in Nigeria. Let's start off with you, Angelo, because what is the current rate of infection of COVID-19 among South Africa's urban poor? Because we haven't really heard much from the continent about the exact locations of the cases.
Well, look, it's quite interesting because up until last week, in fact, most of the testing to see whether there are positive or negative cases in the country was focused on the private laboratories. The public laboratories weren't doing a lot of work. So the figure has been skewed to the richer, more affluent areas of the country, and that goes for all the city centres. So up until then, it's been focused on those who've been able to travel, and much of the positive cases were around people who had contracted or shared the virus after traveling overseas. What's happened from this week on, we started doing mass testing, which means that the 10,000 odd testers go into the communities in the high density environments, and they start testing regardless of whether you're symptomatic or not. So we're going to get a much clearer picture of what the infection rate looks like across the country, specifically around the populations that live in those high density areas. So we're expecting that number to change, but bear in mind that that data is already 2 weeks old. So you're only being able to release data of people who have been infected 2 weeks ago. So we're always playing catch up in terms of what it actually looks like in South Africa at the moment.
Right. What is the scenario, Deji, in Nigeria, particularly in Lagos, which has quite a high number of informal settlements? What is the scenario there?
Cases are still being uncovered in Lagos. They're getting more confirmed cases almost on a daily basis now. Across the country now, we have over 400 cases, confirmed cases now. But the good news, Beatrice, is that more and more people are getting discharged on a daily basis, and people are really happy about that. What the NCDC, that's the Nigeria Center for Disease Control, has now decided to do in conjunction with the Lagos State government is to do house-to-house search now. So this time they've actually expanded. They've expanded the criteria now for testing. What they're now doing is they're sending medical personnel now to move from house to house and actually look for people with symptoms, not basically symptoms now of COVID-19, but people who probably have symptoms of respiratory tract infection. They might not be COVID-19 related, and people who have fevers. what we're beginning to see, even though the authorities are not saying this, what we're beginning to see is that we're beginning to see a high level of concentration now on those informal settlements. For instance, in Lagos, the authorities are now building 20 testing facilities. These facilities are coming up very fast. So what they're planning to do is that they're asking people, especially in those informal settlements, who may have any of the symptoms at all, to simply walk to these testing facilities. That's if the authorities are not able to reach them now, to simply walk to these facilities and get tested. So these facilities are coming up very fast. As I said, the whole fear is about community transmission. And the fear is that if these informal settlements are actually hit, then the situation could actually get worse. Because, I mean, we all know that social distancing is basically non-existent in these informal settlements.
Right.
The way people live there. I mean, you could have 10 persons, for instance, live in an apartment. So the likelihood of spread is very high, and that's why the authorities are actually focusing on these areas, even though it is not identifying these settlements now and not telling us if cases have actually been discovered there.
It would be very interesting to see what would happen in a slum like Hayalitsa, for instance, in Cape Town, with a population of about 400,000 people. What kind of measures is the South African government, though, putting in place there in terms of coordination of relief efforts in managing the situation in South Africa?
Well, I mean, each province, each city, each settlement is responsible to a particular government official. So in terms of relief measures, the government is starting to think about getting more involved with the local communities that are less likely to look after themselves, like you mentioned Khayelitsha in the Western Cape. We've got areas in East London, in the Eastern Cape, that are also problem areas. In terms of relief measures, what's happened is you've seen a lot of charities and a lot of NGOs stepping into the breach to fill the gap that the government officials haven't yet filled. So they're starting to work together quite nicely. The main issue, of course, is around the food distribution parcels. There's also water and sanitation that's being put in place again now. We have the Human Settlements and Water and Sanitation Minister putting water tanks into communities that never had water before. Some are getting running water eventually now after 20-odd years of democracy. So the NGO sector is playing quite a pivotal role here in making sure that the impoverished and the poorer communities and those people living in those informal settlements, if you want to call it that, are able to get something to help them survive. So it is a joint venture between the two. Government is starting to get themselves up and running. The charities, of course, have been operating in this space for a long time, so they know their market, as it were, and they know what the people that they cater to need in Khayelitsha, Eastern Cape, Western Cape, Gauteng, all the provinces have their own challenges, but it seems like there's a coordinated effort, and everyone's taking their lead from the president in terms of getting stuck in, rolling up their sleeves, making donations. Everyone's being called to make donations. We have a solidarity fund that's putting money together for the small and medium enterprises, for those in those populations like Khayelitsha, for example, Soweto, Alex, in the Eastern Cape as well. They are getting involved now, and people are pouring out their hearts and opening up their wallets and donating where they can. Obviously, they can't donate time because they're not allowed to be on the streets, but they can donate in terms of finances or the purchasing of those food baskets or food parcels.
So it does seem that both the South African and the Nigerian governments have put in place a lot of measures to try and contain the spread of the virus into the informal settlements. Deji, to you first, in terms of what you see that has worked up until now during the lockdown, in terms of containing the pandemic from a public health position, and also in terms of the economic sustenance of the communities in the informal settlements. What do you see as having worked in your country, and what is not working?
Well, what has worked so far is that the testing has worked. Initially, when this whole thing started back in February, testing capacity was very low. We had only 2 testing laboratories. Now we have about 13 of them in the country. So authorities are able to test around, at the moment, 3,000 on a daily basis. So in terms of testing and treatment, that has worked. We've seen over 100 persons get treated and discharged. That is definitely working. The response to the disease itself, I'm talking about from the medical side now, that has been working, and it seems to be working very well. But what has actually not worked is the economic side. I'm talking about the palliatives now, what the government call palliatives. The relief effort has actually not worked because, look, the country was locked down. You asked people to stay home, and you know the majority of the people in this country are poor, and these are people who live by what they earn on a daily basis. So you've got to make provisions for them. Now that is where the authorities have actually not really done too well. Yes, they've been able very quickly now, the federal government, the state governments have been able to come up with you know, food items and all of that. But in terms of the distribution has actually been very, very poor. Lagos is a case in point. The very first time the government tried to distribute relief materials, food items, it ended up in chaos. And we're still seeing that chaos. So that's the reason why the government is now thinking of refining and re-strategizing, refining the distribution method now. We're still waiting to see if that would work. But if the government is able to sort that out, then it would have a complete control of the situation.
All right, Angelo, it does seem that there's an economic challenge in Nigeria. From your perspective and what you're seeing in South Africa, what has worked and what is not working?
Well, a couple of things have worked. One, the death toll on our country's roads has almost come back down to zero, which is awesome news because traditionally over that Easter weekend we have a very, very high death toll on our roads. So that's worked in terms of keeping people at home and off the roads. What hasn't worked is gender-based violence has increased because as people stay inside, the people being abused have to live in close proximity to those who are the abusers. So that hasn't worked. The ban on alcohol and cigarettes hasn't worked. All it's done is created a black market and hiked prices and kept money for taxes away from government coffers and going into the hands of the black marketeers in alcohol and cigarettes. So what's not worked is the fact that there isn't an income grant for those who are on the border or who are destitute or poor or unemployed, because companies are going to be going to the wall quite soon as well, especially the small and medium enterprises, and they employ a lot of people who live in either informal settlements, the high density environments like in the city, and those small companies don't have the paperwork in place to get access to the money that's been put there for them to access because they're not formally registered. So if the government doesn't relax those registration requirements, we're going to see a huge unemployment spike because of those small and medium enterprises going to the wall. So a bunch of stuff has to happen very quickly, but it's kind of a 50-50 split in terms of what's worked and what hasn't worked.
All right, Angelo Coppola and Deji Badmus there with an assessment of the impact of COVID-19 on Africa's informal settlements. Thank you both for your insights. And that's all we have time for this week on Talk Africa. Thank you to our correspondents for their continued in-depth coverage of the COVID-19 situation across the continent. Deji Badmus is in Lagos and Angelo Coppola is in Johannesburg for us. Always a pleasure to talk to you both. Now remember to follow the conversation online through our Facebook and Twitter handles, and you can also watch the program on our website and the YouTube playlist. Do join us again next week. For me, Beatrice Marshall and the team in Nairobi, keep safe and goodbye.